No, you're getting old when your teeth don't sleep with you any longer. You know you're getting old when your own people talk about you in front of you. You know you're getting old. Anything I ask them, they'll try to do for me. How busy though they be, anything I ask of them, they'll try to do for me.
If God forgives me and takes me up above, I'll say, God bless St. Vincent and send down on her your love.
My name is Jim Blanc and I've been working in the hospital here in Mountmellick for nearly 30 years now. And over those 30 years I have seen many changes, and I've seen emphasis being shifted from medical, purely medical, to a new holistic approach. But indeed, when the hospital was first built in 1842, its emphasis then was to feed and shelter people. But a lot of people didn't take time to think of the social aspects of a person's life, their intercommunication skills. As long as they were fed, as long as they got their medication, as long as they were clean and dressed, everybody was happy.
It's widely researched that it's important to look after the health and the social gain of older people in elderly care hospitals such as St. Vincent's. So we feel, and I'm very aware and very conscious, that the social needs of the patients are just as important.
Lately, over the last 10-15 years, the idea of treating people just from a medical point of view has changed all over the world. And here in Mountmellick we are trying to lead the field as well, because we have set up a new department called Diversional Therapies. In this department we try to look at the whole person.
I think we all know, even as children love to play, as we grow up we love to play, and activities are very important. So for older people it's just as important, and we need to focus on that and improve their quality of life with social. It's not about doing a job, it's about enjoying recreational activities and involving the patient in something that has meaning for them.
We're trying to make sure that their life is as normal as possible, and that they feel wanted and part of the community, be it the community within the hospital or the community where they come from.
They're no longer a patient, a number in a bed. It is their home, and we try to treat it that way.
Activities can be very individual to each patient, and we try to have them very varied. It gives them a focus, it gives them something to think about and plan, it gives them something to look forward to. It gives them something to work with somebody else, and maybe a bond of friendship. But most of all, it creates an atmosphere that they enjoy.
We have pet therapy. We have a resident dog which is brought in daily or 3 or 4 times a week, and the residents really love it because most of the older people would have had animals. They ask in the morning, is Archie coming in, or is Archie here? We also have massage, where we do hand massage, shoulder massage, head massage, body massage. And this is a very personal massage, where it's one-to-one, and it's amazing to see that the effect it has on people. Snuzzling room, which is a therapy we're based on light and sound. We have music in the background, we have different lights, and it has a very calming effect on people. We have music therapy, and this therapy is provided by ourselves playing music, or also by people outside coming in with like the group of music network. And they really enjoyed this, because music would probably be the only entertainment they had years ago. So now these people actually getting to make music, be it with instruments or with hands or with vocal noises or whatever, but they really enjoy that.
I mean, I can go to the craft room, I can play me bingo, we do the quiz, lovely films to be on and that, exercise, very, and you meet people, you can have your chat there, it's very, very good.
The benefits are enormous to the patients. We work a 5-day a week, and on particular weekends we work as well to accommodate the patients. They intermix very well. We run sessions like bingo, card games, flower arranging classes, painting classes, and this year we painted, the patients painted Christmas cards.
We in the department, we tried to trying and interact with the resident, that they can tell us what they need, be it maybe only getting up to town to go to a shop, or that they're lonely, that we can arrange to sit down with them or make contact with friends.
A lot of people would be shy, and it just helps people to come out of themselves a bit, and I think it makes the day that much more interesting for them. I think especially when somebody is new, and they come in here and everything is so new to them, but they go down to diversion activities and they make friends and they look forward to going back down then.
Life would be dull if we didn't have these activities.
It's ideal for patients. It makes the new people older. There's a new way of life.
Like if you have people who are maybe a little bit agitated, it's a one-to-one, it's a very personal therapy, that you're actually massaging somebody's hand or somebody's neck or shoulder or head or whatever, and it's very personal and it does have a very calming effect on them.
I'm hand massaging Agnes here. It's a very simple procedure, just simple hand massage with oils to relax her and to exercise her muscles. It's a twofold purpose. We get the patient to relax, we converse with the patient, and they're quite happy and they feel that they're special having a massage. Some patients would never have had a massage in their life, and they like the smell of the oils and the different oils and the different functions for the oils. They actually can fall asleep having their hands massaged and their shoulders and neck.
In 1997, I was the person who came up with the idea that snoozland therapy would help our patients, as we had quite a number of dementia and Alzheimer patients within the hospital. You have music in the background. The music is relaxing music. There's no words, so it's not something that you think about, it's just there. Within the room you have the bubble tube, which really is the one area of the room that a lot of our patients liked. Then you have the fibre optics, which when you place these on their lap, in actual fact what we're working on is all the senses. So you're working on what they see, what they hear, what they actually taste, and you're working on touch, tactile. So you place objects on their lap and you watch how they react to them.